Good evening. Okay, we're just trying to catch up on our compassionate allowances that were let in the SSA door in August, a few weeks ago. I'm getting to them. It's just taking a little while. The one we're working on today is the FOXG1 syndrome. This is a child-related disorder, and it's a troublesome one. Obviously, we're born with it. It's genetic. Um, and it's really rare. In fact, there's not a number provided from what I'm seeing here with the SSA, but another link I was looking at for some literature, and I could share it. There's like 1,000 known cases globally. But then through supplemental information, they think that 1 in 30,000 people may have it. So I'm not sure if that's just due to misdiagnosing, and that's why the numbers are weird. But in any event, let's get to it. It's known by various names: FOXG1-related disorder, FOXG1-related encephalopathy, FOXG1-related epileptic-dyskinetic encephalopathy. So those are the three biggies that it's also referred to as, in addition to straight out FOXG1 syndrome. So as they go on to say, and I'll link this is the SSA page on this. It severely impairs the growth of the brain and the body in infants. There's a brain malformation associated with the syndrome, which follows a rather clear pattern where the corpus callosum, which is the tissue that connects the right and left hemispheres, is usually thin, along with a reduced formation of brain folds and white matter. So the children affected by this FOXG1 syndrome tend to exhibit small stature and microcephaly. It says that the effects of the syndrome on the brain cause a significant amount of neurological and intellectual problems, including epilepsy, sleep disturbances, feeding trouble, and behavioral issues. The condition is caused, by the mutation or a complete absence of the FOXG1 gene, which is one that is really critical for brain development. I guess previously, and I wonder if this has anything to do with the numbers and the lack of clarity on how many people actually are born with this, but there's something called Rett syndrome, RETT. And they previously thought that FOXG1 was a variant of Rett syndrome. But Rett syndrome is only found in females, apparently, and FOXG1 affects both females and males. So apparently that makes it not a variant. SSA goes on to talk about the diagnostic testing, and it's generally done through genetic sequencing tests on the patient's blood. So that seems simple enough. Physical findings and what they're going to see typically when the physicians examine the baby or the child, there's going to be a small stature and a small head size. There will often be seizures, cortical vision impairment, global developmental delays. So all those things they know to look for in little babies. There will be apparently global wide array of delays. Sleep disorder, and apparently involuntary movements of the extremities. So that might be when they're referring to the seizure activity. Under the diagnosis code, ICD-9, it's 330.8, and ICD-10 is F84.8. They say that the syndrome is debilitating from early infancy. And then interestingly, it says usually do not improve. I'd be interested in knowing who did and what those situations were about, but usually do not improve. Generally, children never learn to walk or speak. They require lifelong help in performing basic tasks such as eating, using the toilet, all those really basic things that one does just to keep themselves together. Apparently it's very recently identified. So this isn't like a long, if it's recently identified and has become a compassionate allowance, I'm thinking it's been quicker than many of the other ones. So that would be a good thing. They said the conclusive data about its effect on life expectancy is not yet available. And I guess that's because it's been recently identified. So I think that might also have to do then with why there's only 1,000 known cases, right? If it's just recently identified, everything else has been probably diagnosed as something different. And maybe those providers will be going back and re-diagnosing now that this is an official, now known in the medical community syndrome. There is no cure for FOXG1 syndrome. So the treatment is all supportive. It's lifelong care and assistance with the activities of daily living. I don't know what that bodes for in terms of things other than, getting through life at home and getting through, in terms of school and things like that. It almost sounds like it might not be possible, but I don't want to speak out of turn here since I don't know anything about this condition, aside from what I'm telling you about. Okay, so yeah, the genetic testing is going to confirm the mutation of that gene. And they're also going to look at the clinical history and examination that the physician reports. That's just confirming things, I think. The listing levels that it meets as a compassionate allowance is, I'm going to read them off. There's several. 11.02, 11.17, 12.05, 110.08, 111.02, 111.17, 112.02, and 112.05. And as you can tell, those correlate between adult and children listings. They go on to remind us that the adjudicators may, at their discretion, use the medical evidence of record, which would be all the medical records, of course, that have been submitted to the SSA or the SSA has been able to get on its own for you or someone with a case. Or they can use the listings to suggested to evaluate the claim. However, the decision, as they say, and I always find this chuckworthy, the decision to allow or deny the claim rests with the adjudicator. I still don't know exactly what that means because it doesn't really rest with the adjudicator. I'm not so sure. Anyway, all right, so that is FOXG1 syndrome. And the one that we're going to do next, just to give you a heads up, I don't think I'll do it here, but yeah, let's do the next one is going to be Leber congenital amaurosis. Leber congenital amaurosis. I don't think it's Leber. I think it's Leber. But again, what do I know? I'll get to that one shortly, okay? But for now, we're at FOXG1 syndrome. I will tag the couple links that I was referring to so you can look at it. The diagnosis on that one is simpler than a lot of the others we've been talking about because the genetic test itself is going to clinch it. So you don't have to have a ton of other things happen, testing wise. So, all right. Anyway, I'm sorry for anyone who's dealing with FOXG1 syndrome, to the people who have it and the people who take care for them. Be well.